listen to all your podcasts, Dr. Unwin.
Brilliant.
But it's fascinating, and I think one of the first things that people assume is damaging their kidneys, of course, is you know.
I ought to cover that. You're quite right. Yes. So
and protein.
Yes,
meat
you're absolutely right.
Kidneys. Where does that?
So that happened in one of the meetings that I was giving a talk in another country, and a senior dietitian got up and she said, "Why aren't you worried about kidney function? Because you're advocating all this protein." And it was Jen who said, "Well, why don't you look on the database to find out what's happening to the kidney function of our patients?" And that's the basis of the last paper I published. And so you can Google that as well. If you Google renal function and Unwin, and that's been written with Professor Wong, a nephrologist. What we discovered was that the patients who went low carb, even though they were having more protein, had improved kidney function. It did exactly the opposite of what you would have expected. And so that it seems that, at least for my patients, the kidney function improved significantly. And so thank you for pointing that out, because that's the last paper that I published, which was so reassuring.
So kidney function improves if you lower your insulin, despite the fact that you may be consuming more salt.
Yes.
So
I think because one of the most damaging things for your kidneys is a high blood sugar. So I actually think, you know, if I mentioned at the very beginning of this talk that a high blood sugar damages your circulation and the lining of your arteries, well, a high blood sugar also damages the blood flow to your kidneys. And I think that is why people with diabetes, one of the greatest risks they have is deteriorating renal function, and good blood sugar control is key to maintaining renal kidney health. And that's why our patients who have very much better diabetic control have improved renal function. So so also over the years, the number of organs. So at the beginning, I wrote a paper on the liver, because the liver function was improving significantly. So that was a paper in 2015. And then I thought, well, blood pressure. So that was another paper. And then kidney function. So that was another paper. And so it seems, lipid function as well. People worry that their cholesterol will go sky high because they're eating more dairy and eggs and so on. And that hasn't been true for my patients. That's another paper. So it's kept me very busy in the last 10 years.
Dr. Unwin, you've been very busy. I can't even catch up with all your podcasts now. So
Yeah.
I've got a few of them now on my watch later list. So.